schizophrenia the best treatment options. Schizophrenia is a chronic, severe, debilitating mental illness that affects about 1% of the population, more than 2 million people in the United States alone. With the sudden onset of severe psychotic symptoms, the individual is said to be experiencing acute psychosis. Psychotic means out of touch with reality or unable to separate real from unreal experiences. There is no known single cause of schizophrenia. It appears that genetic and other biological factors produce a vulnerability to schizophrenia, with environmental factors contributing to different degrees in different individuals. There are a number of various schizophrenia treatments. Given the complexity of this disorder, the major questions about the illness, its cause or causes, prevention, and treatment, are unlikely to be resolved in the near future. The public should beware of those offering the cure for schizophrenia. Schizophrenia is one of the psychotic, also called thought-disordered, mental disorders and affects a person's thoughts, behaviors, and social functioning. Symptoms of schizophrenia may include delusions, hallucinations, catatonia, negative symptoms, disorganized speech or behavior. While schizophrenia used to be divided into different types of the disorder, it is now considered to have various symptoms of one inclusive disorder. Children as young as 6 years of age can be found to have all the schizophrenia symptoms as their adult counterparts and to continue to have those symptoms into adulthood. Although the term schizophrenia has only been in use since 1911, its symptoms have been described throughout written history. Schizophrenia is considered to be the result of a complex group of genetic, psychological, and environmental factors. Healthcare professionals diagnose schizophrenia by gathering comprehensive medical, family, mental health, and social, cultural information. The practitioner will also either perform a physical examination or request that the person's primary care doctor perform one. The medical evaluation will usually include lab tests. In addition to providing treatment that is appropriate to the diagnosis, practitioners attempt to determine the presence of other mental illnesses that may co-occur with schizophrenia. People with schizophrenia are at increased risk of having a number of medical problems, other mental health conditions, committing suicide or engaging in other self-harm, and otherwise dying earlier than people without this disorder. Medications that have been found to be most effective in treating the positive symptoms of schizophrenia are first- and second-generation antipsychotics. Psychosocial interventions for schizophrenia include education of family members, assertive community treatment, substance abuse treatment, social skills training, supported employment, cognitive behavioral therapy, and weight management. Cognitive remediation, peer-to-peer treatment, weight management interventions, and continued medication refinement. Schizophrenia causes. Genetically, schizophrenia and bipolar disorder have much in common, in that the two disorders share a number of the same risk genes. However, the fact is that both illnesses also have some genetic factors that are unique. There are some genetic commonalities with schizophrenia and epilepsy, as well. Positive, more overtly psychotic symptoms. Delusions are beliefs that have no basis in reality. Types of delusions include erotic, grandiose, jealous, persecutory, physical, mixed, and nonspecific. Hallucinations, hearing, seeing, feeling, smelling, or tasting things that have no basis in reality. Disorganized speech, incoherent or often grossly off-topic. Negative symptoms, potentially less overtly psychotic. Inhibition of facial expressions, lack of emotional responsiveness. Catatonic behaviors, difficulty moving, resistance to moving, hyperactivity, repetitive or otherwise abnormal movements, and/or nonsense word repetition or of what others say or do. Self-neglect, poor grooming, and lack of good hygiene. Lack of speech. Apathy, lack of motivation. Treatments for schizophrenia. Family psychoeducation and support. In addition to educating family members about the symptoms, Course and treatment of schizophrenia. This form of treatment consists of providing family with supportive therapy, problem-solving skills, and access to care providers during times of crises. Assertive community treatment, ACT. This intervention consists of members of the person's treatment team meeting with that individual on a daily basis, in community settings rather than in an office or hospital setting. Substance abuse treatment, providing medical and psychosocial interventions that address substance abuse should be an integral part of treatment, as about 50% of individuals with schizophrenia suffer from some kind of substance abuse or dependence. Social skills training, also called illness management and recovery programming. Social skills training involves teaching clients ways to handle social situations appropriately. Supported employment. This intervention provides supports like a work coach, as well as instruction on constructing a resume, interviewing for jobs, and education and support for employers to hire individuals with chronic mental illness. Cognitive behavioral therapy, CBT. CBT is a reality-based intervention that focuses on helping a client understand and change patterns that tend to interfere with his or her ability to interact with others and otherwise function. Group therapy. Group therapy is usually supportive and expressive, in that participants are encouraged in their efforts to care for themselves and otherwise engage in healthy, appropriate behaviors in the community. Weight management. Educating people with schizophrenia about weight gain and related health problems that can be a side effect of some antipsychotic and other psychiatric medications has been found to be helpful in resulting in a modest weight loss. That is also true when schizophrenia sufferers are provided with behavioral interventions to help with weight loss. Home remedies. Ginkgo biloba. Ginkgo biloba is being studied by the scientific communities as an adjunctive treatment for schizophrenia, as it may help enhance the effectiveness of antipsychotics. Fish oil. People suffering from schizophrenia tend to have low levels of omega-3 fatty acids in their blood, as it is associated with a depletion of certain fatty acids. Exercise. Regular exercise is good for maintaining physical as well as mental well-being for schizophrenics. It helps improve your mood and alleviate anxiety and depression.